Hi, my name is Tammy Johnson and I'm the Hospital Director of Admissions for Rasmussen Regional Hospital. Today we will be discussing Kansas versus Colorado Medicaid. Kansas did not expand its Medicaid. It didn't. The main reason was for the budget. Kansas did an analysis to see whether they could expand or not, and they chose not to expand due to the ACA that there would be an increase in the enrollment for it. The anticipated 10-year budget would raise $400.1 million without expansion, but with expansion it would be $1.2 billion. That increase is a huge impact to a budget of the state of Kansas that was already in a deficit. The issues with filing all the claims was another reason why. It takes 3 to 4 months for Kansas to process an application for Medicaid. HMO plans are not popular in this state. People like having a choice in who they see and different doctors they need for their illnesses. In Colorado, they expanded their Medicaid program, and it has brought revenue to the state. There was 45% of people that qualified for Medicaid and 22% qualified for subsidies for private insurance. It increased jobs in the Colorado state of 31,074 new jobs and $3.8 billion in economic activity. There is little to no restrictions in getting Medicaid in Colorado. If under the income guidelines, you get it whether you are a man or a woman. There is no issues with placement of people due to easy qualification of Medicaid. So, with Medicaid's expansion, it brought revenue to the state, created jobs, helps the vulnerable by everyone being able to apply, helps the nursing homes expand due to the easy access to coverage. Regulations for both states. These rules apply for both to receive Medicaid benefits. License procedures to operate a hospital. In order to operate a hospital, you must have administration and ownership, classification, allocation of beds, special care services, patient statistics, surgical facilities, services and procedures, and outpatient emergency room services and staff personnel. And all your accreditations must be up to date. JCAHO is a joint commission on accreditation of healthcare organizations. To continue getting paid by Medicare and Medicaid, you must keep your accreditation up. It would be terrible for them to lose this accreditation due to the fact that they would lose a substantial amount of money because they don't get paid. Must meet EMTALA guidelines. EMTALA is the Emergency Medical Treatment and Labor Act that states any emergency services, regardless of ability to pay, must be treated. And then there's the statewide repository of health insurance claims from all healthcare payers, including insurers, government programs, and self-insured employee plans. This is for targeting of cost containment and evidence of effects on cost. The difference in the states. Colorado is mandated to do the transparency and disclosure of healthcare costs. It is also essential health benefit benchmark plans are more than what Kansas requires. Colorado is based on the Kaiser Foundation health plan that has HMO plans, and Kansas has Blue Cross Blue Shield of Kansas, and they are PPO plans. The state legislation of Colorado requires hospitals and other licensed or certified health facilities to disclose the average facility charge for treatment that is frequently performed inpatient procedure prior to admission for such procedure. Colorado and Kansas cover vaccinations, early detection services, maternity and baby coverage, and mental health, but Colorado has to cover congenital defects and hearing aids, prosthetic devices, cleft lip and palate, and contraceptives, and many others. HMOs are only going to certain doctors by what the insurance tells you you can see. PPOs are more flexible about what doctors you see and treatments you get. The ethical issues for both states. Kansas not being able to care for the low-income families. Low-income families didn't get help from Medicaid unless they are pregnant or disabled. Men, unless they have minor child, will not get help at all. Fighting chronic illness for the poor. Long wait times for people who do qualify for Medicaid. Long wait times for nursing home placement, and long wait times for treatment and medications. For Colorado, processing claims for the providers has led to long wait times of pay for the providers to get their money. Limitations on what doctors people can see. And qualifications for Medicaid interfere with people getting private insurance and quality of care. Affects quality of care for people who need to go into nursing homes because they are not taking people who don't already have Medicaid due to wait times. That's for the long wait times for nursing home placement. And then long wait times for treatment and medications. Some treatments for cancer are very expensive and can't afford the treatment for medications, so patients are more at risk. And providers are getting upset because it is taking too long to process claims in Denver, Colorado, so that they can get their money. Limitations on what doctors they can see. People want to see their own doctors. It might lead to a misdiagnosis or suffering or wrong treatment. And then qualifications for Medicaid interfere with people getting private insurance. Some people want private insurance but qualify for Medicaid, so it kicks them out from getting their own insurance. And then they have to file appeals, which take a long time. And quality of care. With so many patients on Medicaid, keeping up with the quality of care for doctors and hospitals would be hard to do and be efficient. Recommendations. As the hospital director of Rasmussen Regional Hospital, my recommendations is to 1. Stay in the state of Kansas. Build a non-for-profit hospital. Take what profit we do make and put back into the community. Provide specialty services with qualified doctors and give people a choice on what doctor they want. Help people whether they have the ability to pay or not. Why I feel we should stay in the state of Kansas. It feels more beneficial to serve the people in Kansas by having a nonprofit to give care to the vulnerable, undocumented people of Kansas. Taking our profit we make to benefit the community, the homeless, mentally ill, alcohol and drug addiction centers, and giving people a choice on doctors that they feel comfortable with. And still providing specialty services with a great cancer treatment center, rehabilitation center, and joint and spine centers to get people healthy again to have a quality of life. I recommend staying in Kansas to keep Kansas strong. Thank you.